There are two main tests to assess for gluteal tendinopathy. The first one is the adduction with resisted isometric abduction test. This is an excellent test, along with the next test I'll show you for testing higher demand individuals, such as runners. In order to do this test, you place the femur in line with the pelvis, and you keep the ASIS perpendicular to the table, and you place the hip in maximum passive hip adduction. The patient then performs a maximal make test, and the examiner palpates just proximal to the greater trochanter to try to reproduce the pain. I'm going to do that test now. So they're pressing up as hard as they can. The reason why you want to put this person in this position is because the iliotibial band will compress the gluteus medius tendon against the insertion with the greater trochanter. As you can see, the likelihood ratio for the positive likelihood ratio is quite high. It's above 5.0, which is our cutoff for a useful clinical test. The other test that I like to use with runners is the resisted fader test. In this test, the lateral malleolus of the test leg is positioned lateral to the opposite patella, as pictured, as you can see below. And basically, you're putting them in an end-range hip external rotation position. And again, this compresses the gluteus medius tendon between the greater trochanter and the iliotibial band. The patient then performs a make test, trying to rotate the leg out of hip external rotation by going out into internal rotation. As you can see, the person's pushing out against me, and I'm pushing back as hard as I can. The sensitivity and specificity of this test result in a positive likelihood ratio of 6.6. So this is an excellent test, again, to rule in gluteal tendinopathy with very few false positives. Both these are excellent tests to rule in gluteal tendinopathy, and it's a good set of tests to do if you suspect some sort of proximal hip pathology, such as a femoral neck bone stress injury.